Welcome to the press briefing. On stage, we have Dr. Evan Choi, Controller CHP, Department of Health, Dr. Chang Chok-kwan, Head of Communicable Disease Branch, CHP, and also Dr. Sarah Ho, Chief Manager from Hospital Authority. Dr. Choi will address the media first. Thank you. The briefing will report to you cases reported in the past day. Now, from noon yesterday to nighttime, we admitted a few cases to cause us to feel worried because it's a case 12767, an aircrew member. When he returned to Hong Kong, he lived with his mother. Case number 12754, who was confirmed during quarantine, is a household infection. And arising from this, we admitted a few preliminary confirmed cases, including a 40-year-old female who is a friend of case number 12754. They frequently eat and dance together. So on the 4th of January, after testing, the CT value was 21. Another case also involved 12754 is an Indonesian, a 43-year lady, a foreign domestic helper. Onset was the 2nd of January and test was done on the 4th of January and the CT value was 13, very low. Now, this foreign domestic helper is linked to case 12574 because at one time they had a gathering together in a household. And then another involved a 59-year-old female who is a friend of case number 12754. They had meals together and had many common activities. The 4th case is also a case of concern. It's case 12676 is a 42-year-old man, a surveyor. He was not vaccinated. He lives in Tuen Mun. And his work requires him to go to Victoria Park every day. So he would ride from Tuen Mun to Victoria Park, and he would walk past Victoria Park to his place of work. So at Victoria Park, there was a very far away contact of case number 12754 who had outdoor activity, which is dancing at Victoria Park every day. That's the possible exposure place for both. It is outdoor, and the distance between them was quite far away. According to our inquiry, there was a distance of close to 20 meters. So for these cases, we have this concern. Case number 12754 was not vaccinated, and the CT value was 16.5. The second case was a surveyor unvaccinated with a CT value of 18. Given the low CT value they had, the viral load was high. And before tested positive, they had been to many different places, including eateries. So that is one risk. And then the second concern is Indonesian foreign domestic helpers who had a CT value of 13, meaning a very high viral load. In between the 1st and the 2nd of January, when she was on holiday, she had gatherings with Indonesian friends and with church friends. He had meals with Indonesian friends as well. So these are risks as well. So now we have reviewed all such information. Now the extent of transmission and outdoors were involved, and we are worried that the virus had been present in places where many members of the public were present. For instance, when people were at Victoria Park, there was no ruling out that they could be affected. So the epidemic situation changed greatly over the past day. Dr. Zhang Zhukwan will brief us on places they have been to, including eating premises, and we will check whether these places are linked.
Good afternoon. Last night we have tested 38 cases positive. Case number 12767 to 12804. So far we have some 20 preliminary positive cases. Among the confirmed cases, 31 carry the N501Y plus T478K variant. 2 cases carried N501Y, and we are still pending the results for T478K. 2 cases are still being analyzed. The other case, the viral load is too low and no analysis is possible. Among the 38 cases, 34 are imported, including 3 aircrew members. 2 aircrew members are from Finland, or Finnair. They arrived at Hong Kong on the 3rd of January on AY101. The 2 cases were caught at the airport. The other one was from the US on CX873 on the 30th of December. On the 2nd of January, the patients developed symptoms, sore throat, and then was confirmed. 14 cases are foreign domestic helpers arriving from the Philippines. 13 were arrived at Hong Kong on the 1st of January on CX906. All 13 cases were caught on the sample on the 3rd day from 5 hotels. 5 were at Courtyard by Marriott, 4 at another hotel, 2 at Sky City, 1 at Best Western, 1 at Grand City Hotel. Another case arrived at Hong Kong on Z21264, tested positive on the 2nd day, stayed at Courtyard by Marriott. 7 cases arrived from the US on CX845 on the 4th of January. Also identified at the airport. 6 cases have interchanged at Germany or arrived from Germany on LH796 on the 3rd of January, or caught at the airport. For the remaining cases, 1 arrived at CX252 on the 15th of December from the UK. That is the sample on the 20th day. We are analyzing whether it is a re-positive case. Another patient arrived on KE607 from Korea, tested positive on the sample on the 12th day. We are analyzing whether it is re-positive. The other case arrived from the US via Canada on the 3rd of January on AC015. The other case from Canada on CX865 tested positive on the 5th day. Like Dr. Choi said, we have several cases related to imported case or untraceable cases. The first untraceable case is 12767. He is a 43-year-old surveyor. He lives at Block 2 Training Garden in Tuen Mun with his family members. He works at 169 Electric Road, North Point, Hong Kong, Unit A, 13th floor of Lee and Man Commercial Center. There are some 40 colleagues. It is an office with an open floor plan, so all the colleagues will be considered close contacts and need to be quarantined. On the 2nd of January, he had fever and headache, and then he saw Dr. Hoi Ming between 10:30 to 12 p.m. At the consultation at the lobby, there were some 30 patients. So we are contacting these patients, reminding them to get tests, plus the 3 nurses and the doctor herself. On the 3rd of January, he left a sample. the sample came back positive. Initially, the CT value was 35 to 39. On the 4th of January, at the hospital, the CT value dropped to 18. He had no travel history. He had not visited Festival Walk nor Moon Palace or other places on the compulsory testing notice. We have traced his whereabouts 21 days prior to the onset. Besides work, he would take his child to a fencing academy. On the 27th of December, 2nd of January, and the 12th of December, they went to Joy the Fencing Academy at room 122 on first floor of my loft in Tuen Mun. To be cautious, we have contacted the parents and children to send them to quarantine. His child also learned Putonghua at the Tuen Mun Parkling Square. He also went to the Tuen Mun Town Plaza on the 2nd of January. That is the Eon at Tuen Mun, as well as at the Mills at Xinwan on the 1st of January. On the 30th of December, he also went to M Plus between 1:30 p.m. and 4 p.m. Earlier on, prior to Christmas, on the 23rd and 24th of December, he went to the Hyatt Centric Victoria Harbour, Hong Kong for a staycation. That's not point. He stayed one night there. During the infectious period and the incubation period, he went to many restaurants as well, some 20 of them, including Cheese House at Tuen Mun, He She Eat, Short Ken, Golden Diamond Cuisine, Thai Cuisine, and so on. Customers who have been to these restaurants should pay notice to our compulsory testing notice. Like Dr. Choi said, each day the patients would take a bus from Tuen Mun and alight at Victoria Park and then walk past the Victoria Park. He noticed people dancing and exercising there. For those who danced in the Victoria Park, there is one patient who is related, that is patient 12754. She would dance in the morning, and there were close contacts dancing there as well. Patient 12767, we are still tracing the origin of his infection. From the genome sequencing conducted by the PolyU, his gene sequence is identical to the daughter of patient 12754, the daughter being the Cathay Air crew member. So he is a related case. We are doing our best to track his connection with other cases. From his octopus record, like I said, he went to many restaurants. We found that on the 31st of December around 9 a.m., the octopus records show that he went to a restaurant called Greenwood Cassia Garden Restaurant. The restaurant has this restaurant, case 12754, and another case also went to this restaurant on the same day, that is the 31st of December. We will investigate whether these patients seated closely together and whether they infected each other during lunch. So we would remind all those who have been to this restaurant during the same time to get tested, and we will see any further action is required. Another case, that is 12785. This patient is related to the Moon Palace cluster. The patient's mother, 12673, together with the patient, ate at Moon Palace on the 27th of December. At the time, the girl ate with two friends and her mother during lunch. She studies at the St. Canossian school. She last went to school in December. On the 31st, she was sent to quarantine center and the sample came back negative. On the 3rd of January, she developed a fever and was tested positive. She is a case related to the Moon Palace. She is a student of the St. Rose and Limas College. Besides the lunch at Moon Palace, she mainly stayed at home between the 28th and 30th, and she was sent to quarantine center on the 31st. So far, we have 6 cases related to Moon Palace. We have another preliminary positive case from the same cluster. I will go into the details later. There are 2 other cases related to imported cases, 12786 and 12787. Case, they are the family members of case 12610, a Cathay Aircrew member. They live in Heian Court. When 12610 was tested positive on the 28th of December, these 2 patients were already quarantined. The sample on the 29th came back negative, while the one on the 3rd of January came back positive. They didn't have a lot of activity. They mostly stayed at home. For these 2 cases, there are not a lot of locations to be traced.
Some preliminary positive cases. As said by Dr. Choi, a case was preliminary positive involving a 48-year-old lady who danced together with patient 12754 at Victoria Park in the morning. She lives in Causeway Tower of Causeway Road, which was subject to restricted testing yesterday, and then 116 residents were tested negative because she danced together with patient 12754. She is a close contact. On the 28th to the 31st of December, she went to Victoria Park to dance at around 6:30 to 9 a.m. And then on the 31st of December, they danced together at Causeway Bay Community Center. They dance a plaza, a square dance, and then they also had a meal together at Ming Hin on the 2nd. And on the 1st of January, they also danced together at Hong Kong Park Sports Ground, and then they went to St. John Cathedral. She went to St. John's Cathedral on the 1st of January at 3 p.m. for a short while. We believe the transmission chain is related to patient 12754. So patient 12754, together with more than 20 persons danced together at Victoria Park in the morning. About more than 20 of them have been sent to quarantine. There were 9 of them on the 2nd of January. They boarded the Spectrum of the Seas cruise. So on tracing, we found that they were on the cruise, and we asked the company to sail back, and all 9 close contacts are now sent to quarantine center. They were tested both on board the ship and also at the quarantine center. They were all tested negative. About 2,500 passengers and 12,000 members of the crew on board have all been tested. They are all close contacts of close contacts. So they will be tested again on the 7th of January to play safe. There is still one more linked with 12754 is a foreign domestic helper, an Indonesian foreign domestic helper. She lives at Chesterfield Mansion, which was subject to restricted testing last night. So about 148 residents were tested negative. Together with her employer and 2 family members, they lived together. She developed fever and cough on the 2nd of January. On the 4th, she attended the A&E department of Rajanji Hospital. She was tested positive, and so is now a confirmed case. The employer was also was on the spectrum of disease. Her employer had danced, and very often she sent stuff and drinks to her employer. And one case, 12754, had visited them, so they had met. So after attending Ratanji Hospital on the 4th of January, because she had fever, she did not return home. Rather, she went to a boarding house at a Rio mansion on Kings Road, arranged by her pastor. As a boarding house for foreign domestic helpers to rest, and she waited there. And because she was tested positive, she was directly admitted to hospital from there. So she mainly worked at home, and she had been to Victoria Park to eat, to take walks, and to bring stuff to her employer. On the 1st and the 2nd of January, she was on holiday. And then on the 1st of January, she went to Civil Mansion on the 8th of on number 8 Watson's Row to gather in a church. There were about 50 present, and in the evening she had a meal at Nam Khe with about 7 friends. And on the 2nd of January, she met friends at Victoria Park. They went to the church again. There were about 80 present. And then she started to feel unwell, and then she went to Rio Mansion to rest for a while. And in the evening, she returned to her church to eat with her friends. So those who had contact with her at church are now considered close contacts, and they have to be quarantined. So much for this case. And we have one more case. Have I covered it? Another one who had eaten with patient 12754. A 59-year-old female who lives in on a building on number 41 Temple Road Street. In the morning, she also went to Victoria Park, not for dancing, but to do morning exercise. She was some distance away from the dancers. On the 31st of December, after morning exercise, she went with patient 12754 to have meal at Green Lok Tien Yuen 餐廳. before returning home. And 12767 were there at around the same time, but we have to double check with patient 12767 that is shown in the octopus card. She lives in Serene Court, 41 Tin Hau Temple Road. This 59-year-old female had morning exercise at Victoria Park. And on the 2nd of January, she went to the Hong Kong Products Fair at around 5 p.m. Together with her daughter. They were there for a while. And on the 1st of January, she attended her office at Beilei Cha Hong, her own company. So in between 7 and 8 a.m., she went with her friend to the Hong Kong funeral parlor. On the 30th of December, that is before she had meal with patient 12754. She had been to other places, but those were not high-risk places. We believe the transmission chain is related to patient 12754 more likely. But of course, we'll continue to trace her whereabouts before that. And then on the 30th of December, she had a meal at Nam Gai at Patterson Street. And then she also went to the Hong Kong ID card exchange center.
The
final preliminary positive case is a diner at Moon Palace. There are already 7 customers infected at Moon Palace, and there is another preliminary positive case. This case sat at table 33. That is near the table of 12654, near the corridor. The case was aware that he was a close contact, so he was quarantined on the 4th of January and was tested positive. On the 29th of December, the patient had a test which was negative at a testing center. He lives at Locking House at Tachi Road at Kowloon City with his family members. On the 2nd of January, he went to St. Francis Church to attend a mass, and then went to Choi Yun restaurant on the 2nd with 3 friends. At 10 a.m., he went to Po Lam on public transport for hiking, and then ate at a restaurant at Po Lam. On the 1st of January, he also went to the St. Francis Church. So that's the activities he had. We will continue tracing the close contacts of these patients with a hope to cut the transmission chain. Now, Dr. Ho, please tell us the situation of the HA. Good afternoon. As at 9 a.m. this morning, in the past 24 hours, the hospital authority reported 42 cases. Among patients who have tested positive for COVID-19, there were 2 patients who have been discharged after treatment. 282 patients are being treated in our North Lantau Infection Control Center, CHP's Infection Control Center, and the AWE Community Treatment Facility. 1 patient is serious. 281 patients are stable. The number of negative pressure beds is 1,107. The occupancy rate is 61%. The number of negative pressure wards is 611. Occupancy rate 70%. And I have a report to make. At the North Lantau Infection Control Center this morning, there was a malfunctioning of a negative pressure system at the ward. Around 11:17 a.m. this morning, the isolation ward at first floor of Block E, the negative pressure systems at 12 cubicles malfunctioned. The 12 cubicles housed 46 positive patients. At the time, 2 staff members were carrying out cleansing work in one of the cubicles. They were wearing adequate PPE and they stayed inside the cubicle. Our engineers immediately investigate and fix the system. At 11:49 a.m., the negative pressure system returned functioning. We are still investigating the cause of the incident. During the incident, when the alarm sounded, all staff members were wearing adequate PPE. To be prudent, they immediately put on N95 ventilators. No high-risk procedures were performed. All cubicle doors were closed. The infection control unit of the CHP has investigated the incident and considered the infection risk to be extremely low. That's all for my report. Now we open the floor for questions. Please raise your hands and use our mic to ask your questions. And please identify your media organization. The lady in the middle.
So the first is, can you assess the risk of infection for the domestic helpers in her church and also among helpers? And also, how likely was the surveyor infected at Victoria Park? Does it imply that even just passing by and with the mask on will also be infected? Thank you.
Okay. So I try to explain to you the current risk assessment of our department, and maybe I will ask Dr. Zhong to supplement if any. Okay. So for the risk of the transmission of the domestic helper, indeed we consider the risk of spreading out is quite high. Because at the time we discovered this case, the CT value is 13, which means that the viral load is quite high at that time. So she has visited a number of places where there were quite crowded area, like the Victoria Park, and also she also had visited some places with her friends. So and also the church. So at present there are about 50 people which went to the same church with her on one day, and then another 80 people went to the church on another day. And there are some 10 collaterals which share with the common hostel with her at that time. Okay, so the risk of spreading out is quite high. So we will appeal to the domestic helper to take note of our CTN and to consider to take the test as soon as possible. Yeah. So the other issue is about the surveyor. So the surveyor had visited many places, which at present, when we are trying to match with the current case, which Dr. Zhong and I has reported, there are maybe 2 links that we have found right now. The first link is the Victoria Park that he has walked through the Victoria Park in the morning when he was going to work. And the distance is quite far away from the groups of ladies who are dancing at that time is far away, 20 meters apart, and both of them are wearing masks at that time. So there are possible risks because of the Omicron transmissibility issue. So this is one of the areas we have to investigate. The other, which Dr. Zhong has reported, is the places may be visited by the cases at similar time, like the restaurants. And we are also investigating other common routes, like common places visited by this surveyor and other cases, and also the transportations. So we are now checking the autobus to see whether there's a common path and common places they visited. Okay, Dr. Zhong, please.
Any mass of activities, especially meals and sharing food, they are usually at a higher risk. So for the church attended by the Indonesian domestic helper who has been found to be preliminary positive, he shared food with other church attendees in the evening of 2nd of January. So I think there's a risk of transmission during these meal times. So the church attendees are considered as at high risk, especially those who attended the meal activity at that time.
Next, the lady at the back. I'm from Now TV. I've got a few questions. First, the surveyor who lives in Tuen Mun. It said that his genetic sequencing is very close to 12767, the CX air attendant. Does that mean that the source of infection is from that same cluster? Can you tell us what is the number of what is the generation of transmission? And then you talked about that dancing cluster. Suppose everyone was wearing masks, but then there was still transmission. Does that mean that we have a high risk of community outbreak? Would you regard it as a high risk activity or place? Regarding the 43-year-old foreign domestic helper, her viral load was high and she went to a church gathering with over 80 attendees, and then she also went to a boarding house. I'd like to know how long did she stay in the boarding house, what activity was done during there, was it high risk, and what about foreign domestic helpers who met with her? Should they be sent to quarantine? The third question. Last night, the 43-year-old foreign domestic helper case and the 48 housewife were announced. They were confirmed after they saw a doctor. I'd like to know whether they were identified because they took the initiative to see a doctor. If so, would you say that there is deficiency in our testing mechanism? First, I'll talk about the surveyor, and then Dr. Zhang will talk about the boarding house attended by the foreign domestic helper. These cases were received yesterday afternoon, and our colleagues tried to get as much information from them as possible. Of course, they might have lost track of some of the activities, and we had to supplement with other sources of information, such as octopus information. For these cases, some of them were not vaccinated, and so their viral load was high. For 12754, the case was unvaccinated. So the viral load or the CT value was 16.5. That surveyor was also not vaccinated, and the CT value was 18. Very high viral load. When their viral load is high, when they went to crowded or congested places, the risk of transmission is, of course, high. We are now trying to ascertain the link between this surveyor and the whole cluster. Universities have helped us to do a genetic sequencing. Now, for case number 12767 has genetic or identical sequencing with this surveyor, and we're now doing genetic sequencing to cover the surveyor 1267, the air crew member 12754, the 60-year-old mother, and also a few preliminary positive cases. If the genetic sequencing is identical, then we would say that the transmission is linked. But was the virus passed from one person to another, or were there silent carriers unknown to us? Well, this will a point for investigation. Now, for the inquiries and sequence or genetic analysis, where did the surveyor get the virus? Perhaps they were in crowded and congested places with common exposure, restaurants and public transport. Now, these cases are strangers to one another. They live in different places. So another possibility is when they were at Victoria Park, the exposure took place, although they were very wide apart. We are not too sure about the transmissibility characteristics of Omicron. Now, if you look at Moon Palace within the restaurant, the genetic sequencing was identical, except by Professor Yun. Airborne transmission could cover and at the table almost 20 meters away. So if that took place in Victoria Park as well, and if there were many passers-by and people doing exercise, then the number of people exposed could be quite high. The symptoms for those vaccinated might not be obvious to even themselves. So we're going to issue a CTN very soon for those who have been to Victoria Park during that period. I hope they can be tested ASAP. There are people asymptomatic, and of course there are people who had the symptoms and consulted a doctor and then confirmed. We're at the early stage of investigation, but looking at the risks in the community, there were people, strangers to one another, and they were infected while indoor or when dancing. It could be inside a restaurant or at outdoor. So at this point, I think the risk of transmission of the epidemic is much higher than we first expected. Dr. Zhang, the boarding house. The foreign domestic helper went to church during the 2 days we considered high risk on the 1st and the 2nd of January. After the 1st of January, he went to church and he went back in the evening to eat with other church attendees. That was an high-risk activity, and we were trying to sort out how many were present, and they might have to be sent to a quarantine center. As regards how they became confirmed, now those preliminary positive cases were close contacts. We tracked down, for instance, patrons of Moon Palace. He was already in a quarantine center. And on the 31st of December, who ate at Luk Tin Yun Chan Tang, he was found by us, but even before we found him, he had sent a sample to a testing center, and then we sent him to a quarantine center, and the earlier sample he gave was tested positive, so he was sent to hospital. Another lady, 48-year-old female in the dancing cluster, when we found her, she reported feeling unwell, so she was sent to a hospital instead of a quarantine center. What about the boarding house? Although it was a boarding house, when she stayed there, no one was there. But then she went there twice, on the 2nd of January and the 4th of January. 2 visitors were with her on the 2nd of January, and then, of course, they have to be quarantined. This gentleman at the back, I'm from Hong Kong 01. There are 3 questions. First, the new preliminary positive case of Moon Palace, were told that he seated at table number 33, and then he was sent to a quarantine center on the 4th of July. Was he among the 6 who could not be found, and what is his work? Now we have seen many more cases, and the CE said that she wanted to contain the situation before the Lunar New Year. What is your assessment? Is that possible? It's mentioned that some confirmed cases went to the Hong Kong Products Fair, which is also at Victoria Park. and also crowded. What is your assessment of the risk of that fair?
好，將第一條問題我
I will take the first two questions, and then I will defer to Dr. Chuang. Since yesterday afternoon, judging by the cases we received, the risk of community outbreak is very high, especially when cases linger in the community. It may cause an outbreak. That's what happened yesterday. We have another case in the community beyond the Moon Palace cluster. That's why this morning the chief executive has met with representatives from policy bureaus and departments, and hence the press briefing at 3:30 p.m. announcing tightening of social distancing measures and restrictions. The intention is to cut off the transmission chain as soon as possible before a fifth outbreak. With less gathering, it will definitely help cutting off the chain. Still, if we already had an outbreak before the measures were tightened, we may expect to see more cases in the coming days. These cases were infected before the measures were announced. So we would use 2 weeks' time as a checkpoint. Like the CE said, in 2 weeks' time, we would review whether our measures are effective in cutting off the infection chain and whether we have fewer cases. About events like the Hong Kong Brands and Products Expo, like the CE said, if these events are cancelled, it will help our fight against the virus. For places or events attended by confirmed patients, there would definitely be a risk of infection. That's why Dr. Zhuang's team is tracking every member of the public who has been to these high-risk places for a test. Dr. Zhuang, about Moon Palace. The preliminary positive case from Moon Palace, actually that's a female, 52 years old. She's retired. On the 3rd of January, we have found her. She was sent to quarantine in the early morning of the 4th, and this morning she was tested positive preliminarily. She was not amongst the 6 persons. Next question. Hi, I'm from Cable News. The Victoria Park dancing group, did they wear face mask? What was the purpose of visits to the employer's home, to the home of the employer of the Indonesian domestic helper? She sends the domestic helper away to the boarding house. Is that a standard practice? And now the passengers on the cruise are allowed to leave. Why don't they have to wait for the result? So supposedly the close contacts of the air crew member from Cathay have to be quarantined. They dance in Victoria Harbour, but they were still allowed to board the cruise on the 9th to board the cruise. Why is that? For those who danced in Victoria Park or who walk by, we have asked patients 12767. According to him, the people there all wore masks, whether they were exercising or dancing. After dancing, usually they would eat or go to the home of the dancing teacher to have food. So case 12754 went to the home of the employer of the foreign domestic helper and stayed for 2 or 3 hours with 6 or 7 friends from the dancing group. They had food during this stay. She didn't have any direct contacts with the foreign domestic helper. She was aware there was a domestic helper, but they didn't chat. About the cruise, spectrum of the seas. Some close contacts were among the passengers. After we are aware of them, we asked the staff on the cruise to isolate them. On the cruise ship, there were also some close contacts. For instance, those staying in the same room with them, they were also sent to quarantine centers for a short quarantine. The Spectrum of Disease has an app. It shows that the app would show people who had stayed for a considerable period of time with 1.5 meter apart. It includes some 754 crew members. They have to be tested as well. We don't have one single confirmed case from the ship yet, so we are urging the passengers to stay vigilant and maintain personal hygiene and get another test tomorrow. About the close contacts of the flight attendants, they have been sent to the quarantine center. Family members of the close contact are also high risk. They would be quarantined, but it is impossible to quarantine all the close contacts of close contacts. Next question. The lady at the front. Good afternoon, Ming Pao Daily. 12756 in Victoria Park and the Causeway Bay Community Center. Have all her friends been contacted? And where exactly did they dance in the Victoria Park? Say which courts? What kind of dance are we talking about? Does it involve? Is it very intense and involve intense exercise? And how likely do you think they get the surveyor 20 meters away infected? And one of them has been to the Brands and Products Expo. So how many people have visited the expo during that time? The foreign domestic helper, according to the press release yesterday, the government would send a team onto the cruise for investigation. Has it been done? And are there any risk factors? The surveyor from Tuen Mun, any related cases? He has been to M+ and the Mills. During the time of his visit, how many people were present? How many need to be quarantined? Does he have a child who study at a kindergarten in Shun Dak Tuen Mun Leung Lei Yao kindergarten? What about teachers and parents and students there? Anyone need to be quarantined? And also the Joy Ticket Fencing Academy, the children and the parents have to be quarantined. What about the parents and children at the Putonghua Learning Center? Of course, during sports activities, infection risk is high. We have had cases from quarantine hotels when exercises are being carried out. For example, cycling, the viral load would be extremely high. So this time, we are talking about an outdoor place. Of course, the viral load is high. However, it would be diluted. We are balancing whether the risk is so high or the viral load is so high that another person can get infected even though he is 20 meters away with mask on. So we will issue the compulsory testing notice for those who were at Victoria Park. We have to rule out the possibility. For indoor venues, restaurants, that is also required. These several cases, especially 12767, they have been to many places. For each of these places, we are getting numbers of visitors as much as possible. We are notifying these people via the Leave Home Safe app, but we also rely on the persons involved to take action and reach out to us. Whether this would lead to a community outbreak, the risk is considerable. The viral load was high and it was a crowded places, and the Omicron is a very infectious strain, so it would be relatively easy to catch the virus. It would be even more risky for the unvaccinated. For the cruise ship, 9 close contacts were on board. The 9 close contacts have been quarantined immediately. When we identified the confirmed patients, we found that these close contacts were on the cruise ship. We immediately asked the cruise company to stop the journey and return to Hong Kong. And they had complied. 2 tests have been carried out. One on board the ship tested negative. After unboarding, the 9 close contacts were tested negative again. So 2 tests came back negative. We have a relatively low risk of infection on board the cruise ship. To play safe, we are requiring some 2,000 passengers and some 1,200 crew members or staff members to get tested after unboarding. So far, some 1,000 passengers have left a sample and then left. The exercise is still ongoing. Some 1,000 people are yet to be tested. Later on tonight, the exercise will be completed, and then the staff members will be tested. That's about the cruise. As of now, we have not identified a case from the cruise. If the 9 close contacts were tested positive on board the cruise, our handling with it would be totally different.
Dr. Zhang, well, they danced near the fountain. Well, at the same time, they spent about 1 hour. At the same time, there was the Brands and Products Expo. The daughter bought a pot at Expo. We were told that about 7,000 people were present, and to play safe, I hope that they would all be tested. Regarding AMPAS, I don't have information with me now, but I think they are trying to find out a list of visitors present. The meals, it waits to be seen whether we can get the list. Yes, she studied at that kindergarten, and we asked the KG to suspend class to wait for test results of the child first. We are trying to find out whether there are close contacts there. Fencing 127676. Well, on 12767, he was waiting there with other parents to watch their children playing fencing. For Pudonghua, he did not went up. He just leave his child there. He just left his child there. The last question. I'm from AM 730. Regarding the dancing, what's your assessment? Did the transmission take place at a restaurant or near the fountain? And Luk Tin Yuen Tan Tang, do you know how many patrons were there? And would you inspect the ventilation system? And for that foreign domestic helper, did she reveal that she had a fever at the A&E department? Usually, if someone has a fever, where should they stay waiting for test results? And then she went to a boarding house. Was that at the advice of her employer? Although the test was done for the passengers of the Spectre of the Sea, would you announce the whereabouts of these close contacts? And would you say that the risk of transmission within a family is much higher? Yesterday we were told that Tuen Mun was a high-risk place. Today, would you call Causeway Bay and North Point high-risk places as well? I'll take the first two questions, and then Dr. Ho will talk about testing at hospital. Regarding the cruise, as soon as we know that close contacts were on, we informed the company and asked those close contacts return to their rooms and refrain from gatherings. They boarded the cruise ship on the 2nd and 3rd of January. There was Bluetooth facility on board the cruise ship to check the close contacts of these people. We identified a dozen or so, and they did not stay in the same room for these close contacts. In the surveyor's case, is a case of grave concern to us because we are trying to find out the way of transmission for him, given that his genetic sequencing is identical with that of the cluster. And as for the fountain, yes, of course, he was quite far away, and we are now trying to see whether there are other possible locations, such as restaurants. We are trying to check all places he has been to for investigation. For the Indonesian foreign domestic helper, she felt unwell. She had a cough and sore throat and fever, so she went to the A&E department of Ratanji Hospital for consultation. Yes, that was an appropriate approach. We ask members of the public to see a doctor if they feel unwell, either a family physician or A&E, and then the FDH went to an A&E department. She did not know that she was a close contact. She only said that she felt unwell, so she left a sample. And when the sample was found positive, the CHP tried to contact him at once. There was some problem with communication because she was Indonesian, and then we had a translator to find out her history and information of his employer. So we're able to identify 12754 for further information. I give the floor to Dr. Ho. Yes, we'd like to remind members of the public once again, if there is a contact history, and if you've been to a place where testing is required, you should give details to our medical staff so that we can make appropriate follow-up action and also check-up. You're concerned as to whether some social distancing measures can lead to clusters within a family. Now, if a person is already infected, if we try to stop him from spreading the disease to someone else in the community, of course, this is conducive to containing the epidemic. And anyway, someone goes home every day and contacts with his family members. So we hope that there can be fewer gatherings, even large family gatherings with social distancing. Some may refrain from going out, but a gathering at home In the past, there might not be large group family gatherings to the size of 20 or 30, but with social distancing measures that could happen, but that will increase the risk. Please do remember that our intention is to reduce our gatherings, whether outside or at home, and please avoid unnecessary gathering within the family and with friends. And if you feel unwell, you should see a doctor in the first instance. The sooner you can find out that you are a carrier, then you are offering protection to your family as well, so that you can be quarantined, etc. Speaker was off mic. I wouldn't say there is a super transmission, because patient 12754 and the preliminary positive cases had been in the same place, whether we talk about indoors or outdoor or dancing together. So they might not have just met once. They might have met every other day or every day. Regarding the source of the surveyor's virus, we have to check if it's from number 12754 and the transmission took place outdoors, then we're worried, because the viral load was very high, and if it is outdoor, there can still be transmission. This is quite alarming. So if you have been to Victoria Park, please be tested. The press briefing ends here. Thank you very much.